So the 2 hours are planned out in this particular manner. We will have the first hour, that is between now and the next hour coming up, where we'll just do a quick round of introductions of health logistics and APN, as well as go through a Q&A session where I would like to invite individuals who are privy to information that they can just go ahead and share with us. And then we will have a group work that is about 45 minutes long with 5 minutes presentation for each group. Now the group work will be, I will let you know how the group work will proceed, but it will just be in breakout rooms, Zoom breakout rooms, where you are requested to actively participate so that you can be able to give feedback into the main Zoom room. For the second hour, we will have guest speaker presentations where we are privileged to be joined by 3 individuals from 3 different sectors. That's from manufacturing sector, as well as a private sector and the Ministry of Health. And after that, we will have just a few closing remarks, and which will wrap up this particular live session. Okay, so with me is the moderator of the African Pharmaceutical Network, Dr. David Odiambo, who will be assisting me with the presentation at different points in time. Okay, so for the rest of us, I just request you to stay tuned and keep listening. We try to make sure that it is interesting. So please, where you have a question, you can feel free to put it on the chat box, as well as raising up your hand using the Zoom icon for raise hand, and then we can be able to get to your question or to your concern. Okay. So we'll start off with the introduction of health logistics. So I'm aware that health logistics is not a very well-known organization within the continent, as well as here in Kenya, but we are not, we're a relatively new organization, seeing that we started our activities in Kenya in the year 2016. But the organization in itself has been in existence since the year 2010, having been registered in Switzerland in the year 2014. Okay, so the company HELP actually is under the Kuna Foundation, and the Kuna Foundation is the global umbrella whereby the Kuna and Nagel Logistics Company shares its profits, and so that we can be able to roll out solutions for individuals around the world, catering to different needs. So, for example, Health Logistics under the Kuna Foundation umbrella specifically deals with humanitarian organizations, where we give, where we provide support in terms of optimization projects, which I will just indicate to you in a little bit. And then we simply work with humanitarian organizations, but lately we have been getting in touch with ministries of health, and this is through the regional offices that we have around the world. That is in Asia. We have another office in Middle East based in Amman, Jordan, as well as another office that was recently opened in West Africa, based in Senegal. So we operate as a non-profit organization, and so we just make sure that we contribute to long-term sustainable impact in line with the Grand Bargain and the SDGs. Okay, our mission is to be a catalyst for transparent supply chain and logistics knowledge that will improve the lives, opportunities, and potential of people, communities, and economies around the world. And so we get to do this through 4 main agendas. So the very first one, that is very close to the work that we do, be it in food supply chain or in health supply chain, is about supply chain preparedness and resilience. So we have been rather shocked by what has happened around the world in the last 3 years, and has actually made us start thinking in terms of preparedness and resilience. And so we are constantly investigating ways in which supply chains can be prepared, and at the same time become resilient, so that we are able to constantly deliver assistance and, of course, minimize the economic setbacks. We also work through local training and education. So you attending the MLP is just a channel through which we are able to provide information. And we are collaborating with universities as well as conducting research. This may be through different channels, but the idea is to make sure that the profession of supply chain logistics remains sustainable by tapping into talent and ideas that we see can be able to change ways in which our supply chains are executed and managed. We also work in food supply chains and very closely working with small farmers, not only here in Kenya, as well as in Uganda, in Senegal, in Burkina Faso. So we have been tapping into, those ideas that small farmers constantly have, but never see the light of day. And we want to make sure that we are able to improve food security one way or another. But you see, this is how we work collaboratively, not just with the small farmers, but also with the organizations that are really engaged into making sure that we have a constant and consistent food supplies. And finally, we have strengthening health system supply chains to increase availability of essential medicines. So availability as a KPI has been at the core of the work that we do as health logistics. And we want to make sure that people understand that as long as you do not have commodities available to the beneficiaries who require them, then your supply chain is not really performing well. So we just want to make sure that this message is passed along, and want to see and find ways to improve availability of essential commodities, be it with the ministries of health or collaborating with research institutes or working with other private sector organizations, to make sure that we understand the constraints and we can be able to find solutions for those particular constraints. So there's a lot of work that is happening behind the scenes as health logistics, and this you get to know once you join in our follow us on LinkedIn, so you're constantly updated on the pieces of work that we have been conducting globally, as well as also tapping into our website, where you are given our information as to the projects as they proceed day by day. So the links of those two places I will give you at the end of the session. Okay. As well, we provide our services through technical assistance, which I had mentioned about optimizing our supply chains. We also do this through training, education, and gamification. So gamification is a big thing within our organization. We do realize that you're able to understand how people perceive the supply chains through gamification, and how willing they are to find solutions for the challenges that they experience in their own supply chains, also through gamification. We conduct operational research, and we have been privileged to work with 33 universities around the world and 11 basically in Africa, where we are researching and developing new ways of understanding humanitarian supply chains. And now this is not to pour water over the work that has been done in the previous years, but just basically understand it now from a point of the countries where it is happening. So for example, we have collaborations with universities in Ethiopia, in Tanzania, here in Kenya, South Africa, Nigeria, like where you have this humanitarian context coming up in a rapid manner, so you have to constantly find new ways of resolving things. And finally, we conduct outreach, although this has taken a back seat in the last 3 years because of the COVID-19 pandemic, but we do hold workshops, conferences, and networking events, so be on the lookout for those. Keep checking on our website, keep following us on LinkedIn so that you get to know what's the next big thing that we will be offering. Dr. Odhiambo, I would like you to just step in a little bit so that you can be able to tell us a little bit more about the African Pharmaceutical Network. Thank you.
Thank you so much, Naomi, and thank you everyone for being part of this session. It's a pleasure to be with you all. So in the next session, I'm just going to, there are only 2 slides, and I'm giving you a brief on what African Pharmaceutical Network is about and what is our focus in terms of, as an organization, in terms of driving advancement in the African pharmaceutical systems and pharmaceutical network. So African Pharmaceutical Network, as it is, it's a network of organizations where we look at stakeholders, that is from professionals that are in this place, organizations and stakeholders that have an interest in African pharmaceutical systems. And our mission is to work towards improving the African pharmaceutical systems, and with a focus on ensuring we deliver reliable access to safe, efficacious, and quality healthcare products and the pharmaceutical services that people need in the African continent. And some of the driving factors in terms of when we started the work that we do with the African Pharmaceutical Network was based on the fact that we realized, one, the local industry capacity is limited. Look at it from the access to medicines and all that. More than 90% of pharmaceutical supplies within the continent are not being sourced locally, and therefore that's a challenge. For vaccines, it's actually 99% being sourced externally. Then in the local industry, therefore, actually within there is fragmentation in terms of access to services, and even the players working within the industry are not having engagement forums where they can convene and see how do we then champion for advancement in this industry. So in that case, we looked at it as a way that we could provide such a platform where we bring together different industry players and stakeholders to shape the future of the industry that we desire, and to shape the future of the industry that gives us what advances and what successes we all want to achieve. And then on that account, we acknowledge that there are challenges, and some of these challenges can be coming from a point of capacity. That is why we have some engagements, for example, with the health logistics in terms of the medical logistics in pandemics cost, where we gave you an opportunity to learn about the pharmaceutical supply chain and logistics around it. How do we make the best of such opportunities? So that is the overall focus for us as Africa Pharmaceutical Network. So the work is on, one, best practice sharing. For whatever it is that you're doing in your area of work, you are able to engage with Africa Pharmaceutical Network and share those best practices, which could enable someone to take up action from wherever they are. And as they do that, we are going to improve on the access of the care that we need and improving the pharmaceutical systems within the continent. So that is on best practices, other than the capacity building in terms of trainings. Then additionally, there are some who would have an interest in the local pharmaceutical industry, and they need support in identifying the key areas. So that is kind of tagged what Namu mentioned in terms of the health logistic aspect, the research bit, and actually intelligence, market intelligence on what solutions are viable, what would the future look like, and what are the different drivers for us to make that into place. We don't tell you that we have guarantee that that is how the future will look like, but we try to envision how it would look and do research and engage with stakeholders to get the insight that you need to be able to make such decisions. So those are the key aspects on how we are looking at it. So in the next slide, I'm going to tell you, maybe you can move to the next slide. I'm going to mention some of the key aims that we have. And these aims are, one, we acknowledge that we're working in a highly regulated industry, that is the pharmaceutical sector and the healthcare sector generally. And as we are working in such a regulated environment, we have to ensure that policies and regulations are responsive to the needs. And therefore, by bringing stakeholders together to share best practices, share their experiences and all, we are able to inform policies and to ensure that they are responding to the needs of the market and ensuring access to the quality healthcare services. Continental knowledge sharing, that is from any part of the continent, we can share insights, share best practices, and advance access to care. Then finally, stimulating investment and actually promoting and nurturing innovative business practices. If we can innovate enough and get the best approaches and the best solutions, then we can get financing for such solutions. And in that is how we are able to develop the industry and ensure that we have a robust industry that serves its people, but is also poised for economic development advancement of the continent. So that is the overall focus of us as a team as we work in Africa Pharmaceutical Network. My other colleagues were supposed to be joining, but they were not able to because of other conflicting engagements. I hope we learn together and make the best of this opportunity. So back to you, Naomi. Thank you.
Thank you, Dr. Gambo, for that eye-opening introduction into APN, especially for those of us who had never, gotten in touch with APN before. But this is a wonderful way to get to know the kind of bodies that are enabling us, become more sustainable when it comes to pharmaceuticals production within the continent. So thank you once again. So after that, we now move to the Q&A session. So we had put out a request, to receive your questions and your questions. However, we only received 2. And so those 2 are the ones that we are going to tackle in the next few minutes. And as I mentioned earlier, that if you're privy to that information, kindly do share with us what are some of those experiences that you've come across while working with particular organizations or within your organizations to be able to address the 2 questions. So the very first one it reads, does the African CDC have a preparedness plan for future outbreaks on this scale like COVID-19? Would someone be aware about how Africa CDC works? Maybe they can share with us or has interacted with them.
Maybe I could contribute on that.
Sure, thanks.
Based on the evidence and the insight that I've gotten from some of the work that is being done by the Africa CDC, there's they call it disaster risk reduction and disaster preparedness plan. So as at the moment, there have been interventions that have been put up on the backdrop of COVID-19. There's a task force that actually is working on creating such kind of documentation and seeing how do we become resilient enough to address such kind of outbreaks that might occur in the future. But as it stands, I don't think there's any concrete plan on how that's happening. And they're borrowing majorly on the Sendai framework on disaster risk reduction. So that is as it stands from my insights that I have.
Okay, thanks, Doc. Well, from my end, I am not aware of a preparedness plan. However, I can just give you a little bit of insight into the work that we are doing in terms of preparedness for health supply systems. So we have been putting a model together the entire of 2020 and 2021 that we are looking to roll out with one Ministry of Health here in Africa, but then the information is still yet to be confirmed. So in this particular resilience model, we will be looking at different areas in which we can be able to build up in terms of preparedness. And this has been heavily borrowed from a model that we had designed earlier on in 2018, and that looked at just supply chains in general. However, this one will be looking into health systems specifically. So once this information is out, once again, I will just request you to keep checking into our website just to see how this is going to progress, because we are sure that it is the kind of work that is going to impact health systems going forward. So that's the much that I can say when we talk about preparedness and resilience, not from a standpoint of Africa CDC, but from health logistics. Okay. Anybody else who can contribute to that before we move on to the second question? Okay. So the second one that we received was on module 4, was on vaccination logistics. So what are some of the challenges the continent has faced with vaccination logistics? And I do know we have representatives from different countries here, and they can just briefly let us know what are some of the main challenges that they faced when it comes to, even before the COVID-19 pandemic. We do have EPI going on, and this includes a part, of course, this is a big part of logistics when it comes to pharmaceuticals. However, we would like to hear this now from the representatives of different countries who have joined in onto this call. You can just unmute your microphone and proceed. Thank you. Any contributors? Okay, so maybe from county government, county health representatives. Do we have any who could just briefly share with us some of the challenges that they face with vaccination logistics? Dr. Odhiambo, maybe you could share with us.
So in terms of my observations, and maybe I would mention experience in terms of what I'm looking at.
Yes.
When we look at the challenges in terms of vaccination logistics across Africa, generally at the start of the pandemic, one of the key concerns that came were, we're dealing with a pandemic that nobody had planned for. The vaccines came, yes, but when the vaccines came, the storage conditions were actually extreme, -70°C, for example, the Pfizer vaccine. So it wasn't tenable at that particular moment. So there were a need for how are we going to deal with the cold chain requirement that were not available at that particular moment. So the challenge at that point is ensuring we have a cold chain supply chain network that could be able to sustain that. So that is the first challenge that existed. Then subsequently, when you look at it in terms of the sourcing, we're dealing with a pandemic that is not, it's global, yes. And as much as it's global, the vaccines that are being produced from the developed countries, and with none of them is being produced within Africa at that particular moment, except for now where we have production in South Africa and fill and finish still in Egypt as well. So when you look at those dynamics, no country was willing to issue vaccines to most of the African countries. And even now we're still having the same challenge of vaccine nationalization, where in Africa, we have only 6% of the African continent vaccinated compared to 70% in the developed countries. So we don't even have the supplies available. So what are the procurement mechanisms? And another thing, this is just based on my personal observation and reflections, in the sense that we are talking about access to vaccines in the continent, but as much as we are doing that, even the different pathways that we are exploring, which African countries are financing it, most of it is dependent on donor funding and the global community. For example, when we talk about COVAX. So these are all platforms and networks that are being driven to ensure we have vaccine logistics being managed and all. And one of the things that I believe we all read from the course that we're doing is the aspect on financing. We need to be able to understand the financing models and even the availability of those resources. So this is the moment where you're expecting somebody to give you the vaccines and actually finance them on your behalf. What measures do we have as an African continent to be able to sustain such kind of financing models and ensure the supplies are getting to the people who need them? Then the other bit that came now in terms of the logistics, the last mile delivery. You're dealing with a continent where the infrastructural development is actually dismal. And therefore, in that case, being able to reach the far-flung communities where maybe deliveries would not be possible, we could talk of the cold chain aspect of it. And other than that, even having the people who are going to manage that vaccination program by itself and the communication bit. So you have to coordinate and ensure, well, we'll have a vaccination at this particular site at this particular moment, but people also have jobs to attend to. They have their livelihood that they need to run. So how do we ensure they'll get the vaccination at those particular moments? Then being this, in terms of, let's say, the regulatory component, vaccines have to be regulated, and in vaccines and as any other pharmaceutical product has to meet the regulatory requirements on safety, efficacy, and the quality measures. And on this account, being these vaccines were developed in less than 18 months, we were not able to ascertain the validity in terms of the shelf life they would have. So therefore, they were given a shelf life of up to 6 months or 9 months for the first cases. So within 6 months, there's vaccine hesitancy, the logistical challenges are still persistent and within the continent, and therefore some of them have expired. They might not be reported in terms of our national dailies and all that, but there's products that have vaccines that have expired, and therefore those are losses that we are counting, as much as not all of us are being vaccinated. So those are just some of the challenges that I feel are there within the vaccination logistics. And if I look at it from the scope of what supply chain would entail, we need to assess what is the market of the product, where do we source for them, what are the different factors that play a role within the dynamics around ensuring that they are made available from the sourcing point to the ultimate end consumer, and then we manage all the other risks that are potential within the environmental framework. So that is what I could share on that.
Thank you, Dr. for your contribution. That has captured quite a bit of what is quite literally going on around the continent. There's so much more that you could say. However, Dr. do you think like there's a point where, or a source of information where we can just go in and tap into it, just to understand what is ailing our vaccination logistics? You know, we do read from different sources, and of course we do make notes as we move along, but then there's this one source of information that you feel like is the ultimate, you know, like can give us quite a good overview of what is ailing us as a continent when it comes to vaccination logistics. We would appreciate that if you could just put it on the chat box.
That's fine. I will get some and share.
Thank you. So with these two questions, then we can just move on and see what is in store for us in terms of the breakout room assignment. This is just one of the ones that we curated a couple of years ago, but we do feel it fits the purpose of this MLP because it captures the challenges that are ongoing, and we are constantly being asked to rethink, innovate, and come up with solutions, improve on the way we work in terms of our health supply chains. So we are part of the supply chain unit in an NGO that has been involved in delivering comprehensive health services for vulnerable populations in protracted L3 crisis, level 3 crisis, that's what it means. So your country mission implements health programs for a large UN organization and supports 78 of the country's 1,241 health facilities in both urban and camp settings. The catchment area of the 78 facilities, of which 5 are government hospitals, 23 general hospitals, and 50 health centers, has a population of 500,000. On average, over the last year, there were approximately 20,000 consultations per month across 78 facilities, 130 surgeries, and 1,800 assisted deliveries. The total number of medical workers in the 78 facilities, including doctors and nurses, is 2,500. So aside from ongoing conflicts, recurring flooding, and poor sanitation infrastructure have led to rising numbers of cholera outbreaks in your country. In view of these outbreaks, the MOH has asked your NGO to present your preparedness plan that ensures the continuation of your ongoing health programs. Special focus should be put on availability of PPE, that's gloves, masks, and gowns for patients and healthcare staff in your clinics. Okay, so this is just an overview in terms of the case study. I would like us to break out into let me see how many we are, into 4 rooms, because we have 4 assignments. And I would like us to take a screenshot of the assignment that you're required to report back on. And because of the time, we'll just request you to put in a few points that you could share with us once we come back to the main Zoom room. Okay, so group 1 will conduct a risk analysis and needs assessment. And you can all take a screenshot of this so that once you go into your breakout room, then you will know what you are going to be working on. At the same time, I will be able to post this on each of those breakout rooms. Group 2 will be working on supplier planning. Okay. So the idea is to decide whether you're going to locally source or internationally. Group 3 will be working on identification of potential bottlenecks and minimum preparedness actions. Okay, so these assignments are purely based on the information that you have received through the MLP. Okay, and otherwise you can also include your own experiences to just build up on the points that you will be sharing. And finally, group 4 will be working on coordination. Okay, group 4 will be working on coordination. So I will create the breakout rooms now. And please, when you go in there, just be as vocal as possible so that you can get the group going. We don't have much time, unfortunately. We do have about, let me see, We do have about 15 minutes to discuss so that we can come back and then share our discussions, okay? So kindly accept the invite and just move into the breakout room. Who was leading group one? Maybe you can just share with us a few points of what came out of the discussions. Group one. Dr. Wanjiro, you were in group one.
Yeah, I know you can see me. We were still putting the house in order. Probably you can give us 1 minute.
Okay, group two. Group two were sharing some point, what to share with us some points on supplier planning.
Yeah, Teresia, you can speak on our behalf.
On supplier planning, the question was, how would you do this and what are the most important aspects to consider in finding and contracting new suppliers for PPE? Would you rather consider sourcing locally or internationally, and why? So first of all, we wanted to consider international because we have a supply in our database already, the one who's been supplying PPEs for 2 years. So we might want to go with the international one to save on time and also the process of evaluating a new supplier. Also, important aspects to consider in finding and contacting new suppliers. We were going to look at supply identification. First, we need to identify which suppliers are we going to consider, and to the capacity, are they able to supply the quantities we need, and then the timing, in what period will they be able to supply the PPEs that we need, and also their terms and conditions for the suppliers, and then what kind of agreement are they going to have with us. So those are what we would consider when trying to find and contract new suppliers. So we'd either consider the international or locally, depending on the timing. We'd compare what the international supplier has to offer and also what the local ones have to offer. And then now decide on which supplier will work best with our timing and capacity and agreements, and also the terms and conditions. Thank you.
Okay, thank you, Teresia, for those points. Like it's interesting that we can never be able to put all those points when you're in such a discussion. However, there's much more that goes on behind the scenes when we are working within our organizations. And so, of course, this is just a point where we get to share the most common points that we normally touch on when it comes to supplier planning. So thank you, Teresia, for those points, and I hope you'll be able to take on some of what they have shared. Group one, can I call on you now?
Well, yeah, we can now come back. The first question was to conduct a brief risk analysis for the 2 potential outbreaks in your country. And looking at the data we have picked from there is that there is a population of an average of 500,000 with that is 78 facilities. And looking at the level of the facilities, we can see there is 50 health facilities. So out of 78, if 50 is a health facilities, you see that that means the primary healthcare is the basing. So, so when we are assessing the risk, the outbreak, we could be able to see that the disease prioritization is supposed to be more of a primary healthcare rather than the tertiary level. And of course, looking at the cases that we have 20,000, approximation of 20,000 consultation cases in a month, that means the vulnerability of the population is quite high. That is, if you divide it by 20 to the whole population of 500,000. The second question that we based on the population we want to create two scenarios. That is one high impact and one low impact scenario. What we were doing here is we were, as we were discussing, we realized there is an infectious disease that is cholera. So on high impact case, we shall have few critical cases with fewer non-critical cases, but the critical cases will have the impact as a high impact case. And now the low impact cases will have so many cases because of the infection that the infectious rate is high, but criticality is low. However, in terms of consuming health products, the low impact cases will consume more health products than the high impact cases because the infectious rate is low. So back to you.
Naomi, you're mute.
Okay, sorry about that. So thank you, Dr. Njugi, for the way you have broken down the two bullet points of the assignment that you had. And so now the last part actually, so how would you estimate the number of gloves, masks, and gowns needed per month for patients and healthcare staff in the facilities? How would you go about estimating that, or what information would you fall back on when it comes to estimating the number of PPE that you would require for both scenarios?
Sorry, we didn't give that. Okay, now what we are pointing here is the point of forecasting and quantification section of supply chain. So using the scenario, we are going to use the consumption method. So what was consumed in the previous session, because now this is estimation of the probably the new session or new financial year, if I have to mention that. So using the previous consumption method, there was 20,000 consultation. And we assume the consultation cases are happening they're being done by a doctor or a clinical officer. And then they will move to the nursing center, they will go to laboratory section. So assuming each one of them, they're using a pair. So we shall have 6 per each department. That makes six pairs of cases. You multiply by 20,000, become 120,000 glass in the consultation section. Then we move to surgeries. In the surgical team or in theater, we assume we'll have 3 basic persons. That is a surgeon, the anesthetologist, and a nurse probably who is assisting the surgeon. That's the same thing, 3, but they do double gloving. So it is 6 by 2, that is 18. You multiply by 130 cases. That means I didn't have the correct answer, but I hope if I calculate, I'll get that. And then finally have 1,800 assisted deliveries. And in maternity level, we have the midwife and an assistant. And they still at this section, because the sterile procedure, they do double gloving. So we have 2 persons by 2 pair, that is 4, you multiply by 1,800. And that is how we can use this as a previous consumption method to estimate what we need in the next financial year.
Okay, thank you for just breaking it down to the finest pieces of details of how we can be able to come up with this. I think also another way that we can be able to quickly estimate the number of PPE that we require is when we work very closely with humanitarian organizations that respond to emergencies or to assist in delivery of services. They do have kits, and in those kits they do say, like, this kit is going to be beneficial for a population of, for example, 10,000. And in those kits, they break it down and they tell you like how many gloves they have in that kit or how many masks they have. That's also another source of information that we can use to, because when you're forecasting, you're just giving the estimate that you would require, then you would require some extra piece of information that will show you whether you're on the right track or not. And so the information that you get from a kit can also guide you in terms of how far from the truth are you when it comes to those particular numbers. Okay, so thank you, Dr. Njugi, for that. And group 1, group 2 so far, thank you for that information. Let's move to group 3. So group 3 were about identifying potential bottlenecks and minimum preparedness actions. What did we come up with, group 3? Group 3? Or maybe we can move to group 4. Let's see. Group 4 were about coordination. Oh, okay. Henry, I can see you.
Yeah, so some of the bottlenecks that we've identified concerning supplier capacity is engaging a local supplier, because, for instance, we've been engaging an international supplier for supply, and this is an emergency that requires urgent actions to be taken. So that will be one of the challenges in looking for a local supplier who has the capacity to deliver the PPEs, to supply, sorry. So another issue is delivery of the commodities. Once we've found a supplier who has the capacity, putting into consideration the insecurity and the area is prone to flooding. So those are some of the challenges that we anticipate to face. And then another issue is on importation, custom clearance, and all the other processes that can prolong the delivery of the commodities if we select an international supplier. Some of the bottlenecks that we identified.
Okay, thank you for those points that you have shared with us, Henry. Of course, there are many more that we can be able to identify, but then, of course, context-based, this is now when we can be able to see the broader challenge that is affecting us. Thank you. Yeah. And finally, we have group 4.
Hi, I'll be presenting on behalf of group 4. And first, to apologize, we weren't able to do much because of the time. So we were only able, our assignment was to identify a coordination and communication plan to make sure that our existing programs don't fall behind because of the outbreak. So we were only able to identify the stakeholders, which were identified as the facilities where we run our program. So the hospital staff in the facilities and the communication teams at the government, who we will constantly keep in touch with. The NGO management, so the project managers and the team responsible for running the project and coordinating the project will be among the key stakeholders. And then the suppliers of the PPEs, because we'll need to constantly provide PPEs for our medical staff. So our plan will basically to provide a clear and consistent communication plan with the stakeholders so that our patients feel like regardless of the outbreak that is occurring, that the existing programs will still continue, they will still get the services they get because of us. So that's as much as we're able to do with the time we had. We are sincerely sorry, but yeah, thank you.
Okay, thanks, group 4. Communication and coordination is huge when it comes to resolving challenges that occur within our health supply chains. And of course, there's no one good way, but like there's standard ways of communicating and how to coordinate. However, when you get down to the ground, you do realize that there's going to be a challenge, especially where you have patriarchal societies or women-led societies. Then now you have to engage different ways of communicating with those particular stakeholders. But it would be good, of course, to just get to know like the standard ways, just understand the standard ways of communicating and coordinating when it comes to health management. And there are numerous resources when it comes to communication and coordination planning for health. And then now you go ahead and come up with smarter ways once you get on the ground and understand what it is that they need and how they like it communicated to them. Okay. So thank you, Sylvia and Tim, as well as the other groups that have shared with us their information. It will go a long way into enabling better ways of conducting our supply chains. So thank you all for actively relating with one another in those assignment groups, and then sharing with us what you have come up with. So now we go to the second and final session of this particular live call. And our very first guest speaker is Mr. Vinod Guptan, who is the CEO of Metsos Group. I would prefer to give the honors of introducing him to Dr. Odhiambo, so kindly step in. Thank you.
Thank you so much, Naomi. So as mentioned, our first speaker will be Mr. Vinod Guptan, the CEO of Metsos Group Kenya. He has over 29 years of experience in the pharma industry. And in the previous roles, he worked with Sagipharm, one of the largest pharmaceutical distributors in the country and actually in the region, and currently serves as a board member, Kenya Healthcare Federation, Health Sector Board of the Kenya Private Sector Alliance, that is the private sector arm in terms of engagement in policy. And he's also doubling up as the chairperson of the vice chairperson of the Kenya Association of Pharmaceutical Industries, that is CAPI. So welcome, Vinod.
Yeah, thank you, David. And it's an honor for me to be one of the speakers on this vibrant group or vibrant forum. So having come from the supply chain part of the industry for all these years, we've always considered supply chain to be the service provider when it comes to on the health side of it, the service provider with the health initiatives of giving patients the best patient care that is possible. And best patient care doesn't end with the fact that the clinical services has been catered for. So it also ends up with a lot of products and consumables that are further on required by the patients. Mm-hmm. Having said that, in the supply chain, I think what we foresee in the market is, of course, lack of visibility of data of what is required and when it is required and how much is required. So this is definitely an avenue or an area of concern, and it keeps increasing by the day. So moving on from the heritage part of the way of doing business, we have now moved on to technology. So when it says of technology, we speak of most companies or most professions moving into tech part of the industry and visibly managing their supply chain through the technological partnership that they have with different organizations, providing them various ERP platforms, the hospitals having a hospital management software, patient management software, and definitely the pharmacies having their own point of sale and other inventory management software as well. So having said that, definitely in the supply chain, we are talking of not only products, we're also talking of regulation. And when I mean regulation, it also comes to the fact that how do we support the government to ensure that there is a public-private kind of a partnership into controlling what goes out into the market, what reaches the patient, and also controlling what comes into the market. By that, I mean, we're also looking at legally, officially imported, vetted products through vetted distributors and vetted customers. By that, I mean vetted members or vetted pharmacies and vetted hospitals and clinics that actually handle the products, and hence become the partaker of the supply chain by giving these products to the patient. So it also entails the fact that when we talk of helping support the government initiative of trying to fight illegal products in the market, counterfeits in the market, remember almost 70% of the first point of contact for the patient is always a pharmacy. Now, for a pharmacy, it always boils down to the fact that they would always believe and trust in the traditional kind of an importer or a supplier that they had with them, but they do not know what is the source of the procurement and the products that they get from the different entities that they would buy these products from. So it's also always about belief and trust. And if you see in today's scenario, belief and trust does not work in a business environment. It needs to be very tightly controlled. And probably not speaking much, that's where metsos comes in, and we try and provide a platform to people to try and cater for all these different kinds of interventions that are required in the supply chain. We provide a platform that gives access to quality medicines at an affordable price to the last mile. So having said that, we look at a scenario where we have a vetted distributor onto the platform, vetted supplier on the platform, and we have a vetted customer base on the platform. So it gives both the distributor as well as the supplier the strength of trusting each other, because there's already a pre-vetted market that they're dealing with. And when I say that, so it also comes down to the fact that we are able to provide through the vetted distributor or the vetted supplier, we create an environment for safe trading to happen, and hence break the loopholes of probable infiltration of illegally or unregistered products or counterfeits getting into the supply chain. The second point that we take is that the quality assurance is done by invariably doing random sampling from the market and then sending it to a private laboratory outside of the supply chain system of the importer, and hence ensuring that any product randomly picked from the market is always quality assured. And this gives the assurance to not only the regulator, but also to the customer that is buying the product and to the patient that they're getting vetted products and they're getting good quality products. By having a GPO kind of a model, the order aggregation takes place on the platform. So when an order aggregation takes place on the platform, people now start getting a good price for the smaller quantity that they're able to manage, and hence give better pricing to the patient in the communities that they serve. So maybe I could ask David to bring up a video, which is just 5 minutes for you to understand the entire process that I spoke about in the past few minutes. David, over to you.
Perfect. Thank you, Vinod. So I think let's play the video now.
Greetings to you. My name is Vinod Guptan and I'm the CEO of Metsos Group. It gives me a great pleasure to share with you the Metsos story, offering quality, affordable medicines for all. Better, faster, cheaper. The African pharmaceutical market is the fastest growing market globally. It is expected to be worth $70 billion by 2030, but this growth is constrained by a pharmaceutical supply chain that is highly fragmented. And as a result, patients in Africa spend a higher proportion of their income on medicines than patients anywhere else in the world. In addition, it is difficult for them to access essential medicines, and too often the quality is substandard. Manufacturers do not have sufficient real-time market information or data. They need to forecast which medicines will be needed in what form, quantities, and the regions. Importers also struggle with a lack of data for forecasting, and the multitude of players means each one of them is only able to get a small amount of the business. Distributors are only able to deal in very small volumes, which puts them at a high risk of defaulting on their agreement. Dispensers often have to pay high prices for medicine of uncertain quality, and the smaller outlets only have the means to maintain small stocks. All of this leads to critical issues with access, quality, and affordability of medicines. Without urgent action, the toll on the patient is projected to increase exponentially. At the same time, these challenges also present an immense opportunity for the private sector to deploy technological innovations to increase accessibility to quality, affordable medicines for the most vulnerable. And that is where Metsos comes in. Metsos is an independently operated subsidiary of Management Sciences for Health, which is based in the United States. Founded in 2017, Metsos is a member-based organization which exists to break down the barriers keeping patients from being able to access quality, affordable medicines by reducing cost and improving accessibility while guaranteeing quality across the entire healthcare supply chain. By leveraging the combined buying power of its members, Metsos is able to negotiate discounts with manufacturers, distributors, and other vendors. This enables us to offer our members access to a comprehensive and competitive portfolio of pharmaceutical products that they are able to purchase at a pre-negotiated favorable pricing from our partner suppliers. All of this through our simplified online procurement platform, which eliminates the middleman. Who can become a member of Metsos? Any entity that is licensed to purchase pharmaceutical and healthcare products in Kenya is eligible for Metsos membership. Metsos targets the private sector as a key market, but is equally eager to work with members from the public sector as well. Currently, Metsos boasts over 500 members, including hospitals, community pharmacies, clinic dispensaries, and the dental clinics, covering over 2/3 of the counties in Kenya. How does Metsos deliver value to its members? The benefits of being a Metsos member include access to a comprehensive and a competitive portfolio of approximately over 15,000 pharmaceutical products, a simplified and convenient online procurement platform with price visibility on order tracking, and a solid selection of vetted distributors with diverse offering and countrywide reach. Members also benefit from cost saving of up to 24% a year on pharmaceutical and medical supplies, availability of financing options, data analytics and market intelligence, and capacity building in areas such as financial management, inventory management, and business growth skills. How does Metsos deliver value to its suppliers? The main benefit of being a Metsos member supplier is that Metsos combines the order volumes of its members. This connects suppliers to a trusted market with a wider base of licensed customers that they may otherwise have access to. Suppliers also benefit from increased sales volume and market share, product traceability and trackability, financing options and reduced credit risk, data and analytics, reduced wastage due to expired products. Very importantly, how does Metsos deliver value to the patients? Metsos benefits patients by creating these efficiencies for suppliers and members, which enables cost saving at each stage of the supply chain. Those savings can then be passed on to the patients, helping them save money on essential medicines. Within Metsos' first 3 years of operation, patients have already seen the price of their medicine drop by an average of between 10 to 30%. Metsos also delivers value to the patient by conducting active supply chain monitoring testing through MEDS, the ISO-approved testing laboratory in Kenya, together with other quality assurance agencies, which means patients can have confidence in the quality of the products they receive. If you would wish to receive more information about Metsos and how you can get involved in this exciting initiative phase, please visit metsos-group.com or give us a call on +254 740 417 687. Thank you.
Thank you, David. So this is just to give you an idea to the audience that bringing in technological innovations, whether it's Metsos or whether it's any other technological innovator in the market, we try and bring about a disruption in the supply chain and hence benefit the entire supply chain industry and ultimately the patient. For all of us, it's about the patient journey. It's about the patient who should benefit out of any interventions that are carried out in the market. So maybe, David, I will stop here for any comments or questions that people may have on this call. Over.
Thank you so much, Vinod, and thank you for the wonderful presentation. And we're glad that you're doing work that is addressing some of the needs and actually in line with what our aspirations are. So thank you so much for that. So we'll move to the next speaker, then we'll have the Q&A session as the last bit of it. So the next speaker for a session is going to be Dr. Wanjiru Njugi, who is a BPharm, a pharmacist, a Master of Public Health and a PhD student in public health. He is a health commodity supply chain specialist and a member of the IAPHL, and is a director of Logistics Board of Kenya. So welcome, Dr. Wanjiru Njugi. It's a pleasure to have you here with us.
Good afternoon. Good afternoon.
Good afternoon.
It's an honor to be here. It's a privilege actually, and I'm quite honored to be present on this day. The topic of the day I would like us to discuss is more of a discussion rather than a teaching perspective. It's about the challenges that are affecting the public health supply chains. I took this topic to share with us because if we can be able to capture a number of the challenges that are affecting the public health supply chain, we can be able to create the innovation and platform for our colleagues or even us ourselves to come up with the solutions, because innovation and technology comes to solve the solutions. So some of the challenges we'll have to discuss, I've tried to highlight with them, and as we proceed, I'll be very brief. As I can see, time is not on our side, and thank you. So let's continue. I want to have a very brief introduction into this public health supply chain. And these are the systems that provide the commodity security. And what we are calling commodity security, although we shall explain the next slide, is that access to commodity you need. For example, if you go to a health facility, that accessibility of the product you need, be it a medicine, be it a glove by the health worker, be it another product, that accessibility and availability of that product is what we're talking about and calling it as a commodity security. It encompasses commodity supply chain and of course the medical logistics, where now the logistics system or logistic management information system comes in, which are technologies that are trying to help us to manage the medical logistics. A good example of a medical logistical LMIS system is what we are calling Charge of Kenya, what we are using as we are administering the COVID-19 vaccine. You have seen it online where you register, and of course is the one which is directing you, which is also directing you into where you can get the vaccines and also give you the vaccine certificate. That is a good example of technology. Well, we have a number of policies that regulate health products and technologies, which I can share through the emails from once we are done with this session or even before. And we have also guidelines and of course new policies, which of course have been drafted, especially during this COVID-19 with the COVID-19 task force in place. I would also want to mention about a functional division at the Ministry of Health, which you are calling the Health Product and Technology, and which is a good milestone, because with this, with such a division, we can be able to have policies in place, guidelines, action plans, strategic policies, which are supposed to be drafted, rather than having an umbrella which is masking the whole health product. Why I mention this is because, as we have seen that pharmaceuticals in a healthcare bill, they contribute more, an average of 40 to 45%. If today you walk into a hospital and you're given a hospital bill, you realize an average of 30 to 45% is health products. That is drugs, gloves you consumed, anything that is health products and technology. So it is a good milestone to have such a division that can be able to create policies and guidelines which can be able to help us to cut the cost of health product. We also have two central commodity supply chain, that is namely KEMSA and MEDS at the central level. We can continue, David. In this point, I want to have some few definitions. That is where we are talking about the commodity security. I tried to explain on the previous slide, but this is the ability to choose, obtain, and use health commodity when and where you need it. If, for example, is family planning, would want someone a couple that walks into a hospital, they can be able to have an ability to choose that there must be variety which are available, and also obtain it and make use of that health commodity, which is a family planning. I would like to mention about pharmaceutical management information system, because this is what is trying to change how we are managing the operations in pharmacy. This is a system, of course, I've seen it, a number of people are sharing them from the social medias and also at the ground level. These systems are supposed to help us to manage exactly every operation that is in pharmacy, from the point of manufacturing all the way to use. All these are supply chain steps, and this pharmaceutical system management is quite a useful tool. Logistic management information system, I think I have mentioned it about the charger is an example, which is helping in management of COVID vaccine. And I hope it will be extended to other EP programs which were there before COVID vaccination programs. Health security, just like we have mentioned about commodity security, now health security is the access. Can you be able to access what you need? That ability and access and opportunity to access, be it preventive or vaccination program, it's what we are calling health security. Health systems, of course, these are the organization of the people or the actions which are done, be it a primary action, including a vaccination, which intent is to promote and restore and maintain health. We can continue, David. The reason why I brought this slide on this platform is because we want to understand these two points in real time so that we can be able to know where we are coming from. Let me say that health products and technology are part of the pillars that are making the universal health care, or what we are calling the UHC as a global WHO explanation. One of the pillars is having the access of health products and technologies. And one of the components that is making this to be accessible is what we are calling pharmaceutical system. Well, pharmaceutical system is the structures, and I'll use structures are hospitals, the pharmacies, the manufacturing companies, the metsos, which is here with us. And then people are us, the health practitioners, the people who are facilitating the health, the commodity supply chain, the commodity production. Resources, these include the human resource, finances, and also the products themselves, like raw materials. And of course, the processes, it's the process, these are the steps we are making. For example, if it's distribution of vaccine from the international platform to our Kitengela depot at that is the vaccine depot, to all the way to the facility where the vaccine is being administered. These are the processes we are talking about. And their interactions, how are they being interacting with the broader health system, so that we can be able to have a quality pharmaceutical service that is improving the health outcome. I have cut a lot of sentences in between, but the aim is to say these structures, when they are all conjoined in a well-smooth system, they improve health. When you talk about pharmaceutical system strengthening, these are identifying and implementing strategies that will make the structures, people, resources, and processes to be one uniform thing that can achieve coordinated and sustainable improvement into critical components. This is where now this pharmaceutical system comes in, that we want to improve vaccination. So we must define specificity in a specific way. What do you want to improve? Vaccination. What do you want to improve? The supply chain of a product A, because there's a shortage or there is a regulatory issue. Once you identify the critical component and you bring this coordinated system, that is when you create the pharmaceutical system improvement. We can proceed. Now we go to the core component of teaching. Now this is the challenges that are affecting the public health systems, or the public health supply chain, sorry. And the first one is inappropriate use of public resources. I don't want to emphasize more than we have seen from the previous COVID-19 theft, or the scandals that happened at our central health supply chain. And these are the issues and the challenges that we need to rectify. And I'm very sure I've seen that KEMSA has come out and come up and improve their technology utilization, where they can utilize technology in terms of tendering, procurement processes, supply chain, even distribution, so that they can minimize the paperwork. Because what they have realized that in the previous issues that happened to them, the major cause was the paperwork. But if we can go to technology, we can be able to improve these services and minimize the public resources wastage. Now, the other thing is underfunding. We are all aware that healthcare financing, especially in the third country, there was an Abuja declaration that was there that at least minimum of 15% of the budget at the national levels is supposed to be directed to health sector. But we have seen these in African countries, none of them, including even South Africa, because their last budget was mentioned to be somewhere in 13.5, they could not hit 15%. So we have underfunding issues. The next thing is inadequate pharmaceutical waste management. You have seen our director in one of the logistic is an upcoming organization whereby we want to create a platform where we can be managing what we call reverse logistics, where we can be able to collect pharmaceutical waste from all sources, including primary facility like a pharmacy, all the way to the national level. Because even though we have a document that is how to manage waste, we don't have a structure and resources to manage waste. So this is one of our goals that we can try to achieve in terms of waste management, because it's a challenge out there. If today you ask a parent, what do you do with your paracetamol or antibiotic once your child is, for example, has felt well, and the remaining one, what do you do with it? We did a research and we realized that most of the parents will tell you that I combine that pharmaceutical waste with my normal house waste and dumped it through the normal municipal cancer system, which we both agree that those pharmaceutical could be a poisonous product if they pass through the system. I was also giving an example during one of the documentary they saw with this citizen giving about the dollar waste. We realized that there were those people who were working there that were using the waste PPE as a form of clothes because they were collecting them from the waste, those dump sites. That's a challenge we are creating, because that person is a father at a certain home, and that PPE probably was used, and I'm very sure was used in a COVID center. So if he walked home with that, bearing the mind that probably that's the only thing he'd wear that day, he was taking things to home, which we don't want to mention in details. The other thing is about health product stock out and expiries. This is common in government because of one thing: the national health supply chain warehouse, that's KEMSA and meds, they usually have a longer lead time. So when you want to stock well, the lead time that is in KEMSA is unpredictable. Although now they're trying to say that they want to improve, but in the current state, the lead time is unpredictable. You cannot say it's 2 weeks or 10 days. So that even if you have a buffer stock, somehow you end up utilizing it as you wait for KEMSA supplies. The other thing is uncoordinated procurement practices. This, I would say this, a pharmacist is a core person who is in all activities or in all steps of pharmaceutical procurement, be it quantification, be it forecasting, quantification, procurement itself, distribution, storage, and use. But you realize some counties, once we devolve health, they started using their procurement offices to procure drug where pharmacists does not exist in those procurement offices. So these uncoordinated practices is bring a lot of issues, because at the end of the day, you might find pharmacy has excesses of one product and in shortage of another, because we didn't have another person who is a co-component in all the activities that is supposed to be used. What we are talking about, we don't want to misplace the procurement process, but can we bring the right person to the right time? The other thing is inappropriate medicine usage. This I think is an issue with, especially now we have an antimicrobial resistant issue, because majority of us as Kenyans, and also I think is a global issue, is that we want to use online and realize that I have a sore throat. Then you walk into a pharmacy, can you sell me drug A and B? And before you ask, and on the other side, let me say there is an issue on the other side, because we have converted our pharmacies, instead of being a primary healthcare setting, we are making them as money minting services centers. So even if someone comes in and tell me this drug, you don't ask question whether you have a prescription or not, or sit down and talk with that patient and tell, instead of using this product, use this other one. So that is one challenge that I would like us to solve. The last thing is the poor quality of health and laboratory commodities. Especially during COVID, we have realized that there is a lot of substandard and fortified product in the market. And although it's not well, we cannot justify with the numbers we have or the reports we have, but it's a reality today. And it's not just a Kenyan issue, it's a global issue, because the regulatory authorities at the global level, they shifted most of their power to COVID regulation activities rather than other products. Maybe we can proceed. The other thing is poor utilization of technology like ELMIS. This poor utilization of technology, I'll say this, at the pharmacy level in our primary, that's the community pharmacies, I would like us to take this as a challenge. Can we be able to challenge ourselves at the pharmacy level that we can be able to take data of the patients who comes in, so that you can have a database of even how much people consumed in the product A rather than by money you made. So we make them as a primary level facilities. And this is where the technology will come and help us, so that you can keep patient files and also the product use files. The other thing is inadequate capacity building, especially in health supply chain systems. What is happening is that in the pharmacy school, supply chain is not core component. So what happened is that there will be issues in the training. The other thing is poor data visibility. And of course, the last thing is poor policies and poorly defined policies. Maybe the last slide. These are the remedies. I would say that we can, like we have talked about, strengthening the organization structures like medicine therapeutic committees, and also the health product and technology committees. Then also develop the SOPs from the greater level, adopt technology, for example, the logistic management, like I have just said. Then we can create capacity building. This is on job training and e-learning and CPD programs. Redefine the role of pharmacists in health commodity supply chain. Like I have said, there is a gap between the procurement department and pharmacy department. Rejuvenate the health supply chain leadership and governance. And finally, we can have the data visibility at the community practice level. Now, this is where one core component I would like us to have the challenge, because we have already learned the pandemic supply chain. But in the emergency setting in Kenya, we don't have a policy to tell us exactly what we need to do. And this actually is what happened with the KEMSA. They didn't have an emergency health supply chain policies. So I'd like us to have good coordination. We can have involvement of non-state stakeholders like metsos. They can help KEMSA in terms of these emergency procurement supply chain. We can have institution like AMREF, where they can help us in health financing. And of course, we can have mechanisms which are draining the release of funds. For example, if we can be able to have a negotiation from the Minister of Finance, so that they can understand exactly, even though we cannot hit 15% of Abuja declaration, can we hit 10? So thank you for the chance, and I hope we can talk more and share more. Thank you. Back to you.
Thank you so much for the wonderful presentation, Ranjiro. And you have a grasp of what you're talking at, and you have the experience. I think that is critical for us to see what key contribution do we have to make, and what are the insights from the people who are working in these particular spaces. So thank you so much for that. For those who have questions, please channel them through the chat box so that we have them as we we move towards the end of this particular session. So the next speaker and the last speaker for the day is Dr. Eva Tieno. She's a supply chain manager at Novartis, actually East African cluster. And she has 12 years of experience in supply chain management, inventory management, demand management, business excellence, and third-party logistics provider management. He has worked with a couple of organizations, starting from the Ministry of Health, Kenya, Laboratories Kenya Limited, GSK, Pfizer, and Abbott, and currently is with Novartis, as I've just mentioned. And one of the key things that she's mentioned is that she's a mother of 2 6- and 3-year-old active children who keep her busy as much as they know. So welcome, Eve.
Thank you very much, David. Thank you very much. So thank you so much for inviting me for this discussion. Very interesting and good discussion today. So David, I'm not sure if you'll share. You have the slides. Yes. So
Yes,
I've seen Dr. Ngugi or Njugi Wanjiru has really, really delved in and given us, the aspect from the public sector, which of course, is a big section of supply chain and is commanding actually the economies in Africa. But also, it's also good to look at it from the private, sector. And my experience is in pharma. So I've worked in the pharma, like mentioned. Okay, 12 years is the whole experience, but in pharma, big pharma, I've been in big pharma for 10 years. So at least I have some, experience in what the challenges and issues that I face in my day-to-day work, and what also the market and the global community is now raising as issues or items that are being developed to improve supply chain management. So you can just go next. Yeah, and just before I start, of course, we are having candidates coming from the academy who are so sharp and good now in issues supply chain. But just to point out, of course, the flow, just to have an understanding and background. Of course, supply chain, when you're talking about supply chain, it's end to end. It's from the beginning where raw materials are sourced, sourcing for suppliers, so there has to be some third party management there, and all that. So, and then it goes through, of course, the production aspect, and there's also packaging that also encompass that that diagram. And then you go into, once the products are produced, and then there's the distribution aspect, which it brings in a lot of technical aspects. That's why you're seeing there's a lot of crisscrossing. So there's a lot of collaboration and interaction that happens, of course, towards the end, because there's a lot of players at the end there. So once the products are distributed to the various sections, customers, wholesalers, hospitals, NGOs, and of course the end user, who should always be, is always the person even thought of from the beginning. Even when you're getting raw materials, you want cheap, at least affordable or competitive pricing. You want quality, and everything, just to ensure that the patient gets, the deserved, or the, the what is the word? The approved products with the right quality. Yes, that's the word. Next. David, next. Oh, sorry. So I just wanted to highlight, the issues or areas that we really need to focus on, or where there are some challenges that, most companies or most individuals are not concentrating on, or what if we really give more attention to, then can really improve, the supply chain process, in pharma, or even, of course, medical commodities. So customer service, this I know has been mentioned, but customer service is key for any service, any person providing service, any person who is providing a product, because we are interacting with people. And of course, at the end there at the pharmacy, you are face to face facing the patient. So you really need to consider what the customer requires. There are a lot of demands and requirements, varying requirements, and from the customers. And also sometimes you see, even when you're in the pharma manufacturing kind of setup, you need a lot of information from the market. So you need forecasts, you need sales data, you need all this information to just give you, for you to collect and work on, to give you kind of a planning or forecasting to avail the products for a specific customer. So always just putting your customer at the center and making sure that all their needs are are met, and ensuring that we have the right product always ensuring there's stock, and then making sure that the stock is going to the right person and it's being supplied at the right time. Of course, when you have stock and you're giving it as not as per the delivery schedules, that's also a problem. So the key thing just to manage customer service, in pharma supply chain is, IT. Right now, even from metsos, the platform is just, it's technology is key right now, just to ensure that you can reach as many customers as you can monitor, whatever services you give. So, having a good system integration and good technology just to have that information sharing between your customers, distributors, or even service providers would really, help in you keeping the customer service on top on your food chain. Next, if we can just go to the next point. The other challenge in pharma supply chain is cost. So of course, in any business, the cost is a key thing, because at the end of the day, you want to be able to be profitable. As much as we are ensuring that patients get quality products, they get the right products, we supply the different market. You want your product at the end of the day to be, cost effective, competitive versus the other products in the market. And you also want to be able to have some margins to cover, your costs, and to be able to cover the, all those transportation costs, to cover all that, freight cost and all that. Because right now, when especially pharma is gone global, where the sourcing is coming from, the Asian countries, India, just to ensure that we have competitive raw materials. So there's a lot of, work and ways to just find a way of regulating costs and minimizing the costs that go through this. So here again, just to manage the costs that the different companies are seeing, and the pressures that the companies are seeing in terms of cost management and commodity costs, is also to just leverage on technology. Again, in right now in supply chain and technology, I think it's almost like back to back. They have to work together, because all these technological innovative systems are all to to bring a solution and to improve service or the supply chain. So having technology where you can manage your transportation management system, you can be able to to see in terms of the commodities that you're purchasing, or the raw materials. If you have a system to to monitor that would really help manage or control the costs at the back, and just ensure that you have like a business intelligence kind of system, where you're able to, based on the data and, analytics from the system, you're able to see where the high costs are coming from, and where you can, reduce the costs, and how you can improve, the efficiency of the business. So always increase the quality, aim at increasing the quality of the product, efficiency, making sure that the product reaches the required, end user, the patient, or, the customer. And all this while trying to reduce the costs associated to that. Next. So the other challenge or area that should be focused on in pharma supply chain is planning and risk management. So, of course, everyone knows that, there has to be some kind of planning in whatever you want to supply, whatever you want to source. Even when you're going for how is it called? When you're going for the raw materials or trying to get packaging materials, there has to be, the manufacturers also need to have your forecast, so that they're able to collate the demands, and, using economies of scale, then they're able to also source and get lower, or I don't want to use the word cheaper, but at least competitive costs for, the inputs that is needed for manufacturing. So there's really key focus, I think, in supply chain. If the planning is done really well, end to end, and everyone, the information that goes in obviously it is what will come out. So if you put in the sourcing of, in the beginning of the supply chain flow, If you put in the wrong, it's like saying garbage in, garbage out. If you put in the wrong planning information, or you have the wrong, not updated kind of forecasting, then obviously at the end of the day, you're not going to be able to meet your demand in the market. You're not able to get the supplies to where they're supposed to be. So there's really been a big focus in ensuring that patients don't suffer. And some products are actually very critical, like for the liver, kidney patients, the transplant patients. So there's some items that if they're really not managed critically, then you're actually putting someone's life at risk. So all this planning is key, just to ensure also you're able to manage your inventory so that there's no write-offs, which of course now is going to become financial, and there's some negative impact on the margins or bottom line for the company. So it's just good to have a long range forecasting. So for me, in my experience, the minimum forecast you can always have, at least be sure of, or just have 24 months. 24 to 36 months of forecasting, so that you're able to understand your customers, you're able to understand your market, and if there's any change that you foresee, you're able to work or manage it before this happens. Of course, sometimes it's difficult in the setup we have, where of course sometimes there are tenders, or they're like new products. It's very hard to plan or forecast for new products, because you're just using competitive kind of information or third-party information. So there's a lot of, and even in Africa, the political changes and things that happen. If you see Ethiopia, Sudan, so there's a lot of, politics can also affect your planning, because when a country maybe is going through some turmoil, and then the airports are shut down or the roads are closed, so of course this will affect supplies. So it's as much as we try to plan and have a good forecast, there are also other things that sometimes could be out of our control. That's why it's always good to try and foresee items and supply based on at least have some safety stock or some buffer stock that any customer or distributors can use during these difficult times. So next. So another thing, as much as I said customer service, this is of course with your customer, end user, but there's a very key thing that you have to have, a relationship with your suppliers, partners, and third-party providers. Of course, even if your whatever you sell or whatever you procure, you have to deal with other people. So there has to be some relationship, opportunities, or you just work on strengthening the relationship and ensure that whatever contracts we have with the third-party providers, everyone understands their roles. These are agreed on and are signed. Sorry, I'll try and be fast. So just ensure that we also we create and understand and at least have some standards and follow a contractual kind of, always put down and agree on services and whatever it should be required from the third party. Next, I think I'm almost done. Well, that's it. Yes, then just another thing to add is in the Africa and in the region right now, there's a lot of regulatory changes. Of course, the healthcare authority, health authority like PPB in Kenya is done regulating products, and sometimes there are a lot of changes and there are a lot of regulations that come up. So you just have to be abreast and keep up with the changes that our regulatory colleagues do. And there's always something changing. The moment you've changed something today, there could be another thing changing. So that's why I just said, notice change coming ahead. So always just ensure that we follow, the regulations, and just make sure that these are followed, and expect always change in regulation. Yeah. And then I think this is the second last, supply management. So this is more of just ensuring that in supply chain, we consider the good distribution practices. Of course, this is a common term that we use. just ensuring that at least there's some standards that are followed. The distributors follow this, manufacturers and the suppliers and the logistics people follow the distribution practices, just to ensure that we maintain the quality of the product to the end user. So of course, we follow the GDP, ensure we also have good IT systems where you can track your products or the supply, and also just also a way to have some kind of unique identification. Just apart from products having batches, it's right now the recommendation is at least to have some serialization or labeling or some kind of thing where you're able to track your products in case there's some risk or some loss or some quality issues. Yes, next. Yes, I think that's that. I just pointed out that that's the supply chain process, and we're here to make it work. Just ensure that all the parts are moving. You need everyone in the chain, just for the best and the good for the consumer, the patient. Thank you. I think that's it from me.
Thank you so much, Evelyn.
Yeah.
And it's a wonderful presentation in the sense that the key aspect that you've mentioned, just to speak on the first point, is in customer experience. At the end of the day, we are serving people in the supply chain, whether they are our stakeholders, they're the people we are serving in terms of the market we are selling to if you're a pharma company, and the patients who are ultimately the consumers. Are we managing that experience so that we meet the expectations? And I just reflect on it based on the case that we had, where we were looking at in terms of, if we're at all in the group 2 where we are looking at sourcing from a supplier. Are they able to meet our terms? Are they aligning to what our demands are at that particular moment in time? If we're able to do that within the supply chain, then we are able to succeed and ensure that our ultimate aspirations to be as successful in whichever organizations we are in, and in terms of delivery, quality healthcare products are being met. So thank you so much for that. I cannot see any questions from the chat, so I'll hand it over back to you, Naomi. Take us through the last page.
All right. Thank you, our guest speakers. We can never thank you enough for giving us your time and sharing with us your experience, and of course on the issues that are closer to the supply chains that we work in and the supply chains that we work with also, to make sure that we are able to provide those pharmaceuticals that are critical for our beneficiaries. Access and availability, these have been the key words that have been coming up in the last 3 years when it comes to managing our supply chains. And we always want to make sure that, as Dr. Evelyn has said, that the customer experience is enriched. And so let us always seek to understand what our beneficiaries would like, what our patients would like, how they would like it given, and see how we can be able to make sure that even when they're coming for services, they do not walk out of there regretting that they did not get what they expected, or it was not described well enough for them to understand what it is that they're going in for. So thank you for sharing with us all the necessary information that we require for this particular period in time. And so as we are wrapping up, I would like just to close it off with just this one video. Sorry, something keeps on hanging. Yeah, just a short video that describes what it entails in terms of logistics and supply chains in emergencies.
The supply chain facilitates the warehousing and delivery of supplies during natural disasters or complex emergencies to the affected area and people. Utilizing commercial strategies, logistics is one of the most important tools in any disaster relief operation. The efficient planning, sourcing, storage and distribution of emergency supplies to specialized teams deployed in challenging and volatile environments enables NGOs to deliver aid to areas hit by flooding, earthquakes or typhoons. Stock health centers with medicines, kits and NFIs. Coordinate the transport and accommodation of skilled staff to facilitate response. The objective of NGOs is to deliver the right aid to the right beneficiaries at the right time to save lives. We are working to achieve this goal by getting our people to where they need to be, ensuring they have adequate accommodation and the right equipment and skills to carry out their work, Mapping and forecasting crises regionally to enable us to pre-position essential items to enable faster distribution when a crisis hits. Strengthening our supplier networks at regional and country level through increased advocacy on supply chain preparedness. This includes supplying cash grants. The supply chain facilitates the warehousing and delivery of supplies during natural disasters or complex emergencies to the affected area and people. Utilizing commercial strategies, logistics is one of the most important tools in any disaster relief operation. The efficient planning, sourcing, storage and distribution of emergency supplies to specialized teams deployed in challenging and volatile environments enables NGOs to deliver aid to areas hit by flooding, earthquakes or typhoons. Stock health centers with medicines, kits and NFIs. Coordinate the transport and accommodation of skilled staff to facilitate response. The objective of NGOs is to deliver the right aid to the right beneficiaries at the right time to save lives. We are working to achieve this goal by getting our people to where they need to be, ensuring they have adequate accommodation and the right equipment and skills to carry out their work. Mapping and forecasting crises regionally to enable us to pre-position essential items to enable faster distribution when a crisis hits. Strengthening our supplier networks at regional and country level through increased advocacy on supply chain preparedness. This includes supplying cash grants to beneficiaries where local markets are able to support local requirements. There are 5 key supply chain principles we stick to in order to ensure we get the most from our resources. Accountability. We are responsible for planning procurement and supply activities that are a justifiable use of our budget. Transparency. We use clearly defined processes that are open to inspection and well documented using a wide range of suppliers. Sustainable sourcing. This is an integral part of our procurement and supply chain management processes, ensuring responsibility for our suppliers' environmental, social and ethical practices. Value for money. The concept of price versus time versus money enables us to judge the optimum combination of whole life cost of goods and services. Also keep in mind proportionality, the procedures followed by procurement to ensure the value of goods purchased. Equal treatment and non-discrimination. We are aware of conflicts of interest and always adhere to anti-corruption policies and evaluate suppliers based on the same criteria. Finally, environmental impact is a key concern for supply chain logistics. Ensure greater efforts are made to reduce our carbon footprint by engaging in environmentally friendly responses. Following this approach will enable NGOs to ensure that the right supplies reach children in their time of need.
Okay, and so the challenge still goes on. I mean, we cannot stop learning. NGOs have been the lifeline of most ministries of health, especially in Africa, and they have come up with ways in which they can be able to tackle the challenge of emergencies, and day by day they're getting smarter about this. And so I think it is time that we owned up some of these pieces of work. Let us not be the ones who are constantly relying on NGOs to do this. Let us be the ones who do this. Well, Dr. Njugi was talking about regulations and policies that are coming up. These are the structures that we need to propel us to the next phase of managing our own supply chains. And so let us take that up as a challenge, see how we can be able to work on it and see what it is that we can be able to achieve from doing our own things, our own way, okay? And so as we are wrapping up, I'll put this next slide here so that you can see our contacts. And I would like to call upon our guest speakers just to share with us a statement or two as last remarks for this particular session. So we welcome Mr. Vinod Guptan. His final remarks.
Thank you, Naomi. So my parting shot would be, as we look at inter-country, I think we also need to look at how we can build capacity to have intra-country supply chain more stronger through not only the public and private. So we start looking at a PPP kind of a partnership so as to ensure that we have better responses to definitely emergencies, but also inter-country transfers if there are some stockouts or there are some eventualities that any other neighboring country is able to help manage. So that's my parting shot. Over.
And thank you, Mr. Vinod Guptan, for your parting shot. Dr. Wanjiro Njuki.
Yeah, hello again. My parting shot, I'll say, I would like us to challenge ourselves to accept the noble theme of, can we be able to learn and learn and learn again? A man who never reads is a man who is halfway dead. So I'll challenge us to learn from each other, from one another, and even from ourselves. That's the challenge. Let's learn and learn and learn. Thank you.
Thank you, Dr. Wanjiro. I definitely, we need to learn and unlearn and relearn. Yes, that is absolutely true. Dr. Evelyn?
What do I even say after such a remark?
Challenge.
I know I have no quotes, but just to, what I've learned and what I've seen, in just supply chain and improving supply chain. Let's take up technology. Just let's develop our expertise in technology and grab any innovations that comes up so that, you're able to be efficient and sufficient in your work. So take up technology.
All right, thank you. And so there it is. We have been challenged enough as to what it is that we need to look out for, look up to, and be ready to engage with. So as a parting shot from our end as Health Logistics, please do feel free to reach out to us. My name is Naomi Mureithi. I am a pharmacist by profession and a supply chain consultant for health systems and pharmaceuticals within Health Logistics. I have been the one at the forefront of developing most of the learning content that you have been able to engage with. And I do hope that it's going to be beneficial for you and your colleagues. Please feel free to reach out to us through the email address that I was reaching out to you with in the past few weeks. And our channels are always open. Dr. Odhiambo?
Thank you so much, Naomi. And thank you everyone for being part of this session and for taking up the course, because at the end of the day, we are all building ourselves to be the better persons that we need. So as much as we've done all these, there's still room for engagement, as I can pick from all the speakers that have shared today. Collaboration, that is public-private partnership, intra and inter collaborations, looking at learning and learning, continuous learning, then ultimately taking advantage of the technological solutions. If we are able to work with you and engage in these areas, we'd be more than glad to contribute in that agenda. So as African Pharmaceutical Network, we are open to engagements and collaborations, and feel free to reach out to us. I've shared the different links to the LinkedIn page and the LinkedIn group that we have. Reach out through there. And as well, you can send us an email on africanpharmanetwork@gmail.com. We'll engage and we'll do the best that we can. Thank you so much.
All right. Thank you, Dr. for your kind words. And maybe just if you're able to start your video so that I can quickly take a picture just to see some faces of the people who engaged with us for this closer session, I will actually appreciate. There we go. Okay, let's see some more faces, more faces. Okay, yes, coming in, coming in. Nice to see. Okay. We go. All right, so here is, I'm taking the picture finally with the few who have decided to. There we go. And another one. Thank you so much. And I want to wish you all a lovely year ahead. And please do engage with our content now that you have access for the next 3 years. We do have another program, but I will be sharing with Dr. Odhiambo on how to proceed for that particular learning program. Thank you all very much and have a good day and a good weekend. Bye.
Thank you. Thank you. Bye.
Thank you. Have a great one, everyone.